Although most doctors try to give their patients the best care possible, sometimes they do prescribe a test or a treatment that's unnecessary. It's bad for your health and often for your wallet as well.
So when should you say no to your doctor, and what are the questions that you should be asking before and after treatment? Dr. John Santa is the medical director at Consumer Reports magazine, and Dr. Keri Peterson is a practicing internist. Good morning to you both.
Good morning.
So sometimes doctors do prescribe things that may be unnecessary, but is that usually the result of patients asking for those treatments, Keri?
I actually think it's multifactorial. First and foremost, physicians are trained in their residency to do things a certain way, and it can be a hard habit to break as rules or guidelines evolve. And as you mentioned, if a patient does come in insisting on a certain test and has a certain agenda, for example, I want an antibiotic for my cold, it can be very hard to change their mind. And I often find for myself, I don't want to miss anything. I want to cover myself and make sure that the patient, that I can cover all bases and make sure that I don't miss anything.
Well, could a doctor be, I hate to say this, but prescribing something to help his bottom line?
Well, at Consumer Reports, we're concerned that the business of medicine is interfering. Doctors and patients are overwhelmed with ads and promotions about health stuff. And in many situations, doctors are paid more the more they do. And that's a concern.
Keri, how do you get the confidence, though, to contradict a doctor? This is somebody who lives and breathes medicine, who went to medical school. I didn't pass high school biology. How do I know that I know better than the doctor?
Well, I think the first thing is that you need to either be able to say no or ask certain questions head on. And we came up with a few questions, one of which is, do I really need this? Ask your physician, put them on the line, and they should be able to answer you honestly and directly, do I actually need this? Ask them, is this safe? Are there safer options? That way the physician will give you the risks involved, potentially tell you if there's a chance of false positives or if there's any side effects. And also you can ask them, what if I do nothing? What if I just wait it out? Are there lifestyle changes that I can make? Then the physician will also engage it. Do you need to make any lifestyle changes, or can you just wait it out and see if you get better?
And cost important as well, because sometimes what they're prescribing may not be covered by insurance, right, Dr. Frost?
You bet. More and more, we're going to be responsible for the cost of the health care we get. We need to know that up front, what we're going to be responsible for.
Okay, so some of the things you can say no to, like antibiotics for something like a sinus infection.
That's really important. Sometimes patients come in with a respiratory infection wanting an antibiotic, and the majority of the time it is viral. In those cases, you really, as a physician, have to put your foot down because there are side effects and you can breed resistance.
How about this one, Dr. Santa? MRIs for headaches.
Most headaches can be sorted out with just questions and answers. A good doctor can figure out what's going on with most headaches, so you don't need imaging that can expose you to radiation, confuse the situation, and potentially harm you.
And what about x-rays or CT scans if you have something like a bad back?
Well, as was discussed earlier in the show, most back pain can get better on its own if given time and conservative measures like anti-inflammatories. And if you do order an x-ray, for an x-ray of the spine, it is 15 times more radiation than a chest x-ray. A CT of the spine is 60 times more radiation than a chest x-ray. So you can do harm with that as well.
What about these full body scans? You've been hearing a lot about those.
Exactly. Lots of advertising and promotion. It's a fool's errand. When you don't know what you're looking for, to just go on a journey and radiate everything is just exposing patients to radiation they don't need.
Is that a red flag when you start seeing ads like on billboards and all that, the people touting this thing?
You bet. You bet. Be wary. We're all wary of that. Well, you should be wary of it in healthcare too.
All right. Well, guys, thank you so much. Appreciate it, both doctors.
Thank you.